Welcome to Review Central. This is NCLEX Reviewer number 8, featuring questions on safety and infection control. This reviewer is intended for those who are eyeing, or are set to take either the NCLEX-PN or the NCLEX-RN. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous NCLEX exams. Let's begin. Question number 1. In the U.S., what should an HIV-positive mother feed her HIV-negative infant? A. Breast milk. B. Frozen breast milk. C. Irradiated breast milk. D. Formula. The correct answer is D. Formula. In the U.S., HIV-positive mothers should feed infants commercially prepared formula. In developing countries, safe water for mixing with dried formula and formula itself is difficult to obtain. Breastfeeding may be the best option in this case. Transmission rate of HIV by breastfeeding without antiretroviral therapy is about 40%. Question number 2. Which of the following statements about Bordetella pertussis infections is false? A. Antibiotics do not prevent transmission of the disease. B. Antibiotics may alter the course of the disease if started early. C. Azithromycin is an effective first-line antibiotic choice. D. Death may result. The correct answer is A. The statement, antibiotics do not prevent transmission of the disease, is false. Appropriate antibiotics prevent transmission and also decrease respiratory isolation from 4 weeks to 1 week. Both erythromycin and azithromycin are good first-line antibiotic choices. The disease is easily preventable with appropriate vaccinations. Question number 3. An outbreak of diarrhea occurs in a daycare center. Which of the following is not an important infection control measure in this setting? A. Written procedures for hand washing. B. Removal of all toys from rooms where children eat and play. C. Diaper changing areas should not be located in food preparation areas. D. Exclusion of children with diarrhea or stools that contain blood or mucus. The correct answer is B. Removal of all toys from rooms where children eat and play is not an important infection control measure in this setting. All frequently touched toys in rooms where infants and toddlers stay should be cleaned and disinfected daily, but it is not necessary to remove them. Hand washing for everyone is a vital part of infection control, especially during an outbreak. All staff must be made aware of good diapering practices. The health department recommends soaking contaminated surfaces for at least 20 minutes with a 3% hydrogen peroxide solution and then rinsing them with water thoroughly. Question number 4. Which of the following potentiates lithium toxicity? A. Hyponatremia. B. Hypernatremia. C. Hypokalemia. D. Hyperkalemia. The correct answer is A. Hyponatremia. Physiological effects of lithium are inversely proportional to serum sodium levels. Hyponatremia potentiates lithium toxicity and causes serious adverse effects. Hypernatremia can reduce the function of lithium. Question number 5. When is varicella considered to be non-contagious? A. 1 week after all the lesions have cleared. B. All the lesions are crusted over. C. Fever is absent for at least 72 hours. D. Patient is on medication for 48 hours. The correct answer is B. Varicella is considered to be non-contagious when all the lesions are crusted over. Patients with varicella should avoid contact with pregnant women and children who have not had chickenpox. Visceral dissemination of varicella leads to pneumonia, encephalitis, hepatitis, and disseminated intravascular coagulopathy. Visceral dissemination of varicella is a risk to immunocompromised patients. The wild type of varicella zoster virus causes breakthrough varicella infection in a vaccinated person. It occurs after more than 42 days after vaccination with varicella. The rash in breakthrough varicella infection is mostly maculopapular rather than vesicular. Question number 6. What is the importance of developing and coordinating the case plan? A. Development and coordination advance the patient's best and highest outcome. B. The case plan is made readily understandable. C. The case manager wants to document the job was done. D. The patient can receive reimbursement for care. The correct answer is A. Development and coordination advance the patient's best and highest outcome. Development and coordination focuses the plan to maximize outcome. Careful development and coordination decreases the potential for errors and mistakes. Discharge planning, aftercare, and coordination of services increases efficiency, safety, and effectiveness. Question number 7. When tissue transplant is performed from the right thigh to the chest in the same individual, how is this termed? A. Allograft. B. Autograft. C. Heterograft. D. Xenograft. The correct answer is B. Autograft. Autograft is a self-tissue transplant. Isograft is tissue transplant between genetically identical persons. Allograft is tissue transplant from another person. Xenograft is tissue transplant between species. Question number 8. A patient has PO medications ordered at 0600. You note an order on the chart that states, NPO after midnight for surgery. How do you proceed? A. Administer the medications as ordered. B. Do nothing, sounds like a DSP or a day shift problem. C. Hold medications and call the provider to clarify the order. D. Sign off the medications on the MAR and remember to give later. The correct answer is C. Hold medications and call the provider to clarify the order. Clarify orders as soon as possible. Consumption of fluids prior to a procedure might result in severe health consequences. As such, the issue, in the interest of patient safety, must be addressed. Therefore, in the above situation, you must hold the medication and contact the provider. The provider then has the option to change the order to NPO except for SIPs with meds, or modify the medications ordered from PO to IV form. Question number 9. In a child who is diagnosed with infectious diarrhea, what precautions should be undertaken when obtaining vital signs? A. Wear a gown. B. Wear a mask. C. Wrap with a bed sheet. D. Wash hands before obtaining vitals. The correct answer is A. Wear gown. Gowns are mandatory when treating a child with an infectious disease. Gowns and gloves are worn while in the patient's room and removed before leaving the room. Hands should be washed when entering and exiting the room. A patient with diarrhea or a gastrointestinal infection is placed on contact isolation precautions to prevent the spread of the disease. All visitors must check with the nurse before bringing items in or out of the room. Question number 10. Which group is least likely to have strongyloidiasis? A. Wealthy communities. B. Former war veterans. C. Immigrants and travelers. D. Groups occupationally exposed to soil. The correct answer is A. Wealthy communities. Strongyloidiasis most commonly occurs in poor communities. Inappropriate living conditions for the population with 5 to 6 people living in one room or improper sanitation are factors for this infection. During times of war, living and hygiene conditions are sanitarily poor. This can explain the strong prevalence of cases among war veterans. When infection occurs within those in low socioeconomic status communities, there is a higher rate of morbidity and mortality. Strongyloids infection is attributed to climates with low precipitation and temperatures below zero. However, incidence has been found to be less prevalent on climate condition, more so on hygienic and sanitary factors. You have just completed NCLEX Reviewer number 8, which featured questions on safety and infection control. If you wish to watch more NCLEX reviewers on safety and infection control, check out our NCLEX Safety and Infection Control Reviewers playlist. Check out also our other NCLEX playlists for other reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful and feel free to share to anyone who may also benefit from it. We wish you all the best on your forthcoming NCLEX.